Welcome back to Tipping Point. I'm your host, Kara McKinney. Over the last week, Democrat-run states and municipalities across America have announced rollbacks and, in some cases, elimination of many COVID mandates, following the example of states such as Florida and countries such as the United Kingdom and a handful of other European nations. The move was at odds with the Biden administration, which continues to push its aggressive mandate policies, even as the Supreme Court strikes them down and blue state allies drop them. You may remember back on January 14th, Health and Human Services Secretary Xavier Becerra declared the 9th straight 90-day public health emergency. I guess we now know what old Joe meant when he said back in November of 2020, "I'm never going to raise the white flag and surrender." Sometimes lost among the discussions of government overreach and destruction of personal freedom associated with COVID policies is the extremely high cost of these public health emergency declarations. Our next guest has determined that each declaration costs taxpayers, meaning you and I, at least $4.5 billion in extra Medicaid spending. Joining us now to discuss this issue in his latest investigation is the CEO and founder of OpenTheBooks.com, Adam Andrzejewski. Thanks for being here tonight, Adam.
Great to be on the program, Kira.
Great. So when it comes to these 90-day public health emergency renewals, you reached out to the HHS for comment. What was your concern and how did the agency respond?
So the agency responded that, yes, we're in a public health emergency because at the time, in the middle of January, there was 1,900 daily deaths attributed to COVID. Now, we took a look at the common flu between 2017 and 2018 as reported by the Wall Street Journal. And there was 1,500 daily deaths with the common flu, influenza. So the COVID daily death rate was only slightly elevated versus the common flu from 2017 and 2018.
When it comes to these public health emergencies, there seems to be such a web of funds and healthcare and treatments and everything else all interwoven within it, all reliant upon these emergencies being renewed every 90 or so days. Do you think it'll ever end because of that?
So we took a look at the evidence right in your own homes. For example, the test kits. They're only authorized. You can only use those test kits underneath a public health emergency because they're only authorized for emergency use. Same thing with the vaccines. If you have a Moderna vaccine, a J&J Janssen vaccine, they're not allowed unless America's in a public health emergency. Only Pfizer has the only shot for people 16 and older that could be used outside of a public health emergency. Now you take a look at the treatments for COVID, your monoclonal antibodies, your convalescent plasma. Those treatments can only be used underneath a public health emergency. Outside of that, it's illegal to use those treatments. So if COVID's going to be with us for a long time, but the lethality of it is decreasing, we're going to be in a public health emergency because all of this, the whole system's built on an ongoing basis on the emergency use authorization, which can only come about because of a public health emergency.
And every time these are renewed, a couple billion, it basically costs us taxpayers. So how much money since the first public health emergency was declared has it cost taxpayers since then?
Yeah, it's a great question. At least $50 billion of additional Medicaid spending. And that doesn't even include the Medicaid spending that is attributable to COVID aid. So it's decision time for the Biden administration. We unearthed the memo to the 50 governors. This did not get play. It's exclusively breaking on your show right here tonight, Kara. And this memo said that during 2021, that the entire year would be a public health emergency. So on day 2 of the Biden administration, they told the 50 governors in this secret memo that the whole year would be a public health emergency, and they would give a 60-day notice if it wasn't going to be the case. I reached out to Health and Human Services on a request for comment, and they confirmed that the 60-day notice is still in place. So 30 days ago, they extended for the 9th time the public health emergency for 90 days. So right now, tonight, it is decision time for the Biden administration. Either they're going to give a 60-day notice to the governors and the public health emergency is going to end at the end of 60 days, or they're going to have to do another 90-day extension 60 days from now.
And this is why it seems like it truly just never ends, just keeps going on and on and on. And while I have you here tonight, I just have to ask you, because you also authored another article that recently came out, I believe that Real Clear Policy, talking about some of these Soros-backed immigration lawyers and other type of nonprofits, and actually over $158 million, I have the numbers here, our government has been handing out to some of these groups. Talk to us about some of your findings there.
So the Biden administration handed out $158 million of legal aid to a nonprofit group in New York City. This nonprofit group is on the progressive left. They've advocated to defund the police and actually dismantle the police. They've advocated that all illegal entrants that are in ICE facilities should immediately be let go. They've been given this massive contract. This contract has ballooned up with some other contracts to over $200 million. And so the objective of this organization, the Vera Institute for Justice, is to provide lawyers for every single illegal entrant, lawyers that come out of their network funded by you, the taxpayer.
Well, Adam, keep up the great work with your reporting and digging up some of these numbers. And thanks for joining us tonight.
Thank you, Kara.